I got a really devastating diagnosis of cancer, and at that time, I was trying to plan for a birthday party for my 1-year-old son, and then I was trying to plan who my doctor was going to be for a number of different things that I needed to have happen in the next 6 months. It was an overwhelming time, but I felt really comfortable with this decision, which was one of the first decisions I had to make for my treatment.
My patient philosophy is very simple. It's family. I can't really say it any better than that. And we've tried to design our new practice with the patient in mind. And every time we have our staff meetings and discuss this with the nurses and techs, the conversation always circles back to the patient. We really tried to make patients feel relaxed, like they're almost at home, like they're sitting in their living room. We didn't want them to feel like they're in a hospital.
The clinic here that Dr. Khan has built, it feels like a spa. It doesn't even feel like a doctor's office when you come in, but that's what you need because you're so nervous going into these situations that being in a sterile hospital environment sometimes doesn't help your feelings.
The workflow, we designed it to flow naturally with what is being done. Specifically, if you're a clinic patient coming in for a clinical consultation, you go one way. If you're a surgical patient, you go the other way. We have private waiting rooms for the patients undergoing procedures.
Walking into some place where there's smiling faces and everything seems clean and like they take care of things, you just know that the care they give you as a patient is just going to be that much better.
Our electronic medical record is designed to provide the best in terms of correspondence and communication, not only with the patients, but also with the referring doctors so that people know what we've done while the patients were under our care. We did little details in our procedural suites, such as we put a TV in the ceiling. But if you're having a longer procedure, it's certainly much easier to go through it if you can watch a television show. It also helps put the patient at ease. So these little details that we try to focus on, I think, will go a long way.
It was actually the first time I've ever had surgery. I'd never had surgery in my life. So going in, I was nervous just about the anesthesia. Every part of it was scary for me, but I felt really comfortable. Dr. Khan seemed relaxed and confident as soon as I got in there. The staff around him was so friendly and nice. It just felt like I actually didn't have time to really get nervous before I was whisked in, and then we were done with the procedure before I knew it.
That was my goal in designing this facility, is to really, no corners are to be cut. We needed to make this a first-rate facility in every single aspect, whether that's the staffing, our equipment, our inventory, our care both pre and post. Everything needs to be state-of-the-art.